I had a patient, my first year I was in Austin, and she had fallen on some steps over at UT, landing on her rear, and she had loosened some ligaments basically where the spine attaches to the pelvis. And she was on disability for about a year. Real nice lady, only spoke Spanish. She worked in housekeeping at UT, and so she, through her friend who was helping translate, and was just like, I've got to get back to work, and we tried everything I had ever been taught. And the only thing that would keep her out of pain, at least temporarily, was if she wrapped this belt around her pelvis real tight and just kind of squeezed it all together, and then she could get around okay and do her day-to-day activities, but she couldn't work. She would come in each time with her friend and lay down, and we'd feel all these tender spots and do a little injection, and she was very verbal, very vocal. I told her I would do 3 treatments. That's all I was going to do, because I just really haven't been trained in this, and we'll do 3 and see if you feel any better. So she comes to follow up, and she didn't bring her friend with her. So we couldn't really communicate well. I was like, boy, maybe I can find somebody in the hospital that can come down and help translate. And meanwhile, she keeps saying injecciones, injecciones. And I'm like, yeah, we're not doing injections today. It's, we're just following up. No, injecciones. And finally, she drew the paper out on, I had these rolls of paper on the table. And she drew it out, and she took my pen, she drew a big circle, and then she drew a little smaller circle, and a little smaller circle, and then she was like pointing it. And she was like, duele, duele, menos, menos. It's like, the pain was like this, and it's just been shrinking. And after not changing for a year, I'd followed her for a year, and just nothing we'd done had helped. I was like, that kind of fits. If her body's building new tissue and tightening it down, that's what would happen. It would slowly improve over time. So eventually she convinced me to do more. I did 3 more treatments, and she got back to work. I was like, okay, I need to look into this more. I'm very convinced that with fibrous tissue, as long as it's not a complete rupture where there's no connection, if there are some fibers connecting, then the body will start filling those in and tightening things up.